Alright guys, for health this week we're going to talk about diseases. The first topic we're going to discuss is communicable diseases. Okay, the learning outcomes. After studying this lesson, you'll be able to understand the nature of communicable diseases. You'll be able to explain the types of pathogens that make you sick. You'll be able to describe the different methods of disease transmission. You'll be able to understand common communicable diseases, and you'll be able to describe the treatment methods for communicable diseases. The term communicable means able to be transmitted. If a disease is communicable, that means it can be transmitted to you. In other words, a communicable disease, also called an infectious disease, is a condition you can develop after coming into contact with humans, animals, or plants infected with a disease. 12-year-old Dakota knows that communicable diseases like the flu are different from diseases such as heart disease that he may inherit from his parents or grandparents. A communicable disease is one that he can catch. When his friend Tavon came to school with the flu last month, for example, Dakota ended up sick too. Dakota cannot, however, catch heart disease. In this lesson, you will learn about the causes of communicable diseases. You will also learn about the common communicable diseases that you may encounter in your life. Finally, you will learn possible treatment methods for communicable diseases. Understanding communicable disease. Common living things that you can see are called organisms. You, your teacher, your dog, and the trees outside are all examples of organisms. Many living things, however, are too small to see with the naked eye. These microorganisms are so small that you cannot even see them without the use of a microscope. Certain microorganisms, known as pathogens, can cause communicable diseases. The term pathogen is a more scientific way of describing germs. Pathogens are everywhere. They are so small, however, that you cannot see them. Pathogens are only visible with a microscope, which magnifies them or creates a bigger image of them. While most people are unfamiliar with pathogens, these microscopic organisms influence human lives in many ways. Pathogens include bacteria, viruses, fungi, and protozoa. Bacteria. Bacteria are single-cell organisms that live in almost every place where life can thrive. Bacteria even live inside the human body. In fact, so many bacteria live in the body that of the several trillions of cells that make up your body, 90% are bacterial cells. You may find it scary that bacteria are nearly everywhere. The good news is that most bacteria are helpful. For example, the bacteria found in your body help the digestive system function efficiently. These bacteria also prevent harmful bacteria from thriving in your body. The bad news is that certain varieties of bacteria can cause different kinds of illness. Some of these illnesses may be minor, while others can cause quite serious and can be even deadly. One type of bacteria that causes disease is E. coli. E. coli bacteria typically live in healthy people's and animals' intestines. There are different varieties of E. coli bacteria, however. Some varieties are harmless while others can cause food poisoning. Exposure to harmful E. coli bacteria can occur from eating contaminated foods such as undercooked ground beef or drinking contaminated water. If you get sick from food poisoning, you may develop symptoms such as diarrhea, nausea, fever, and vomiting. Another common type of bacteria is S. aureus, is present in about 30% of people's nasal passages. The bacteria S. aureus often does not cause any harm. It can, however, spread to others through contact with contaminated hands. Sometimes S. aureus causes staph infections, which are skin and soft tissue infections. Anyone can get a staph infection, especially if you have a cut or scratch. People with chronic disease and weakened immune systems are at a greater risk of developing a more serious staph infection. Viruses. Viruses are very different from bacteria or cells in your body. Viruses are much smaller than bacteria, and they are completely incapable of doing anything cells can do on their own. Viruses depend entirely on other cells for reproduction and growth. In fact, every virus must live inside a cell and use that cell's resources and energy to grow and reproduce. Viruses must be inside another living organism to thrive. Though viruses can stay on the surface for a short time, they will die quickly if they do not find an organism in which to live. Once inside the body, a virus invades a person's cells and multiplies quickly. The result of a virus multiplying is an illness. Fungi, or fungus singular, are multicelled plant-like microorganisms that thrive in damp, warm places. These microorganisms are much more complex than bacteria and viruses. Examples of fungi include mushrooms, molds, and yeast. A fungus cannot produce its own food, so it receives nourishment from plants, foods, and animals. Like bacteria, few fungi cause disease, and many are beneficial. For example, the mold known as Penicillium notatum makes the life-saving drug penicillin, an antibiotic that controls bacterial infections. Other fungi, however, damage crops and stored foods. A few fungi cause disease in humans. Ringworm, athlete's foot, and jock itch are common fungal infections. People with weakened immune systems may be more likely to contract a fungal infection. Protozoa are single-celled microorganisms that live nearly everywhere and only cause few disease. Many kinds of protozoa form the basis of food chains, providing nutrients for other organisms. Certain protozoa, however, cause some of the world's most feared diseases. These include malaria, a dangerous flu-like illness, and dysentery, a severe intestinal infection. Protozoa thrive in moist environments and typically spread through contaminated water. Methods of transmission. For a disease to be communicable, it must be able to transmit from one source to another. Pathogens causing communicable diseases may travel by various methods of transmission. A method of transmission is simply the way a disease gets from one organism to another. Methods of transmission are either direct or indirect, depending on how the transmission occurs. Direct transmission is the movement of a pathogen from an infected person to a susceptible person. A person is susceptible to a disease if he or she is likely to be easily affected or harmed by it. If a person has a weak immune system, he or she may be more susceptible to a disease than someone with a healthy immune system. Indirect transmission is the movement of a pathogen to a susceptible person through a source that acts only as a disease carrier. In this case, the carrier is simply moving a pathogen from one source to another. There are many examples of communicable diseases, and most are not serious or life-threatening. You will likely encounter one or more communicable diseases during your life. Some common communicable diseases include influenza, mononucleosis, tonsillitis, and conjunctivitis. Okay, so some of the methods of transmission include droplets spread, and those are spread through coughing, sneezing, spitting, or talking. So that's why it's important that whenever you cough or sneeze that you do it into your elbow so that it's not putting it out there for everybody else to get. Direct contact transmission, that's shaking hands, hugging, or kissing. Vectors are animals, so like you saw with malaria, mosquitoes can cause that to spread. Food and drinking water, so they could be contaminated during growth, harvesting, storing, processing, or preparing. So if somebody is making you food and they have contamination material on their hands, it can make you sick. Contaminated objects such as doorknobs, light switches, medical instruments, and shared needles. That's why it's important for those things to be sterilized. And airborne contamination, and that's in the air through coughing, sneezing, spitting, or talking. Again, that's why you want to make sure you cover your mouth or your nose whenever you cough or sneeze. Alright, so the first virus we're going to talk about is influenza. Influenza, also known as the flu, is a viral infection of the respiratory system. This means the virus infects the nose, lungs, but it also causes symptoms through the body. The flu moves from person to person through droplet spread and sometimes through contact with an object touched by an infected person. The best treatment for the flu is to get lots of rest and plenty of liquids. And if you look at this graphic on the side, it tells you what the difference between the cold and the flu are, because sometimes it's hard to tell which is which because they share some symptoms. Mononucleosis, also known as mono, is a very common viral infection. This infection is often known as the kissing disease because it typically spreads through direct contact such as kissing. Mononucleosis may also spread by sharing objects such as cups, toothbrushes, and lip gloss. Symptoms of mononucleosis include fatigue, fever, sore throat, loss of appetite, and sore muscles. Some people experience mild symptoms. Others experience no symptoms at all. A person experiencing any combination of these symptoms should see a healthcare provider for diagnosis and treatment. And it's also important to note that mono does last for a long period of time. When I had it, it lasted in me for about 7 months. So it makes you very, very tired. A virus or bacterium may cause tonsillitis, which is an infection that affects the tonsils. The tonsils usually protect the body from infection. Sometimes, however, the tonsils become infected. Symptoms of tonsillitis include sore throat, fever, painful swallowing, and vocal changes. If you think you have tonsillitis, you should contact a doctor. Often, the best treatment for tonsillitis is getting lots of rest and drinking plenty of fluids. So if you look at the back of the throat on each of these pictures, you can tell whether you have bacterial or viral. The bacterial, you have a little more swelling and more white spots. Conjunctivitis is also known as pink eye, is a viral or bacterial infection that causes inflammation of the conjunctiva in the eye. The conjunctiva is the tissue that covers the eye and inner surface of the eyelid. Inflammation of the conjunctiva results in itchiness and a red or pink appearance, which gives the condition its name. Pink eye may also cause swelling of the affected eye and discharge or liquid that leaks from the eye. If pink eye is the result of a bacterial infection, treatment typically involves the application of antibiotic drops to the affected eye. If the infection is viral, however, antibiotics will not work. A viral infection will run its course and go away as the body fights it. So you kind of just have to deal with it until it's gone, if it's viral. Treating communicable diseases. Treatment methods for infections vary depending on the type of infection. To treat bacterial infections, many doctors prescribe antibiotics such as penicillin or amoxicillin. Antibiotics are substances that target and kill pathogenic or harmful bacteria. While antibiotics generally work well to treat bacterial infections, they do not work against viruses, fungi, and protozoa. Medications cannot treat a virus, but some medications can help treat the symptoms of a viral infection, such as a fever and body aches. So if you have the flu and you have a fever and body aches, there are some medications that can help with those symptoms. The best treatment methods for viral infections are good rest, nutrition, and fluids to strengthen the body so it can fight the virus. To treat fungal infections, doctors often prescribe antifungal ointments or creams that are applied directly to the infected area. Doctors may also prescribe medications to treat infections caused by protozoa. These medications are determined on a case-by-case basis depending on the type of illness, the person's symptoms, and his or her overall health.